Good evening, everyone, and thank you for joining our Men's Health webinar. We'll start with a few housekeeping items, and then I'll introduce tonight's speakers. First, your participation in tonight's webinar is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speakers. If you wish to ask a question, please type it in the chat box at the lower part of your screen, and we will have a Q&A portion at the end of the presentation to address these questions. Our presentation tonight will last for approximately 1 hour and will be presented by Dr. Omer Raheem and Dr. Sarah Faris of the University of Chicago. Dr. Sarah Faris received her medical degree from the University of Michigan in Ann Arbor before completing her internship and residency at Vanderbilt University Medical Center in Nashville, Tennessee. After that, she completed a fellowship at the University of Iowa in Iowa City. Dr. Faris is a board-certified urologic surgeon who specializes in a wide range of male and female urologic conditions, with a primary focus on male and female reconstructive urologic surgery. Dr. Faris is an expert in urethral and uteral strictures, prosthetics, and slings for stress urinary incontinence. Dr. Raheem received his Doctor of Medicine degree from the Al Mustansiriya University in Baghdad, Iraq. He then went on to attain his Master of Science and Master of Chirurgy from Trinity College in Dublin, Ireland. While in Dublin, he achieved his membership of the Royal College of Surgeons of Ireland. He then went on to complete both his internship and urology residency at the University of California, San Diego, followed by a fellowship at the University of Washington in Seattle, Washington. Dr. Raheem is a board-certified urologist specializing in men's sexual health and male infertility. He is an expert in diagnosing and treating a wide range of urologic conditions, including erectile dysfunction, Peyronie's disease, male infertility, enlarged prostate, and urinary incontinence. Thank you again for joining us tonight, and now I'll turn it over to Dr. Faris to get us started.
Good evening, and welcome to this. Thank you to everyone who's joining. I'm going to start off the event by talking about stress incontinence and your treatment options. So what is male stress urinary incontinence? Incontinence is also known as bladder leakage or leakage of urine. And stress incontinence in particular is when the urinary sphincter is damaged or weakened and it can't squeeze enough to stop the urine from flowing out of the body when you do things like active things like lifting, coughing, laughing, bending, pushing, pulling, moving. It's very prevalent following surgery for prostate cancer. However, usually most people heal within the first few weeks to first few months, and about 9 to 16% of men will have persistent stress incontinence after a year of surgery. So worldwide, approximately 500,000 men suffer from stress urinary incontinence. The general process is that the bladder stores the urine here, and the urine exits the body through here, and it goes through a passage in the prostate, and then down through the urethra here, and it comes out. This part of the urethra here at the base of the prostate is the sphincter, and those are the muscles that surround the urethra and help to keep they're kind of contracted, and they help to keep that urethra squeezed so that you don't leak. When the sphincter's muscles relax, the urine is able to exit the body via the urethra. Things that correlate with stress incontinence is very strongly correlated with the prostate cancer surgery or other things like neurologic disorders, enlarged prostate surgery, so BPH surgeries. We can see that in about 1 to 3% of men after that. Radiation can contribute to stress incontinence at about 1.6% of men, and pelvic trauma as well. This can have a massively huge effect on your quality of life, which is probably why if you have this, you're here today. People with stress incontinence, they're very frustrated with they feel like they can't go out as much. They worry about their pads. It can affect their mood, and they can feel socially isolated because of this. So about 180,000 men are diagnosed with prostate cancer each year in the US. And about 70,000 radical prostatectomies are performed each year, which is that surgery you have your bladder here, and then we talked about the urethra again, and we actually remove the prostate here and put the urethra back to the bladder. Now that sphincter mechanism that we talked about is right at the base of the prostate. Approximately 9 to 16% of men will have persistent incontinence after 1 year of treatment, as we mentioned earlier. It's very normal to have incontinence right after radical prostatectomy because for most men, the prostates act as their continence mechanism. So they're not used to engaging those muscles. And you can train your body to do that. That's what Kegel exercises and pelvic floor physical therapy help with. But for some men, and so most men recover within a year, but as we mentioned about that 10 to 15%, it doesn't come back after a year. And that's what we're here for, is to help those people who want to regain continence and normalcy. So some of the short-term treatment options, some people restrict their fluid intake, especially before they go out. As a urologist, to be honest, I don't love that because we want you to stay nice and hydrated. It's good for your kidneys. And they do planned restroom breaks as well. Interventions, so things like the pelvic floor physical therapy we talked about, and those Kegel exercises to really work on strengthening those muscles. And then there's the coping, which is doing the pads, the diapers, catheters, or penile clamps. But one of the problems is that the pads can be not only very expensive, but people worry about the fact that they smell like urine or that they may leak. The urine pads might leak, or they may have an accident out in public. And in the bulkiness as well. People also are bothered by them when they go out to travel, for example, having to carry around extra pads, or what if I travel to a place and I can't find them and I run out, and issues with that. And then catheters themselves may be discreet, but they can be uncomfortable, and long-term use can cause infections, some erosion of the urethra, and it has other potential issues. The penile clamp can control leakage, but you can't wear it all the time. I mean, it's a pressure on the urethra, so it has to be removed on a regular basis, and it can be painful and uncomfortable for some men. So some of our long-term treatment options that we really talk about that can, if it persists despite this, or you're interested in treatment, one of them is a male sling, which actually supports the urethra. It kind of acts like that sphincter mechanism to support the urethra to give you better control of urine. And studies have been shown that it's actually most appropriate for mild to moderate stress incontinence. The sling itself is made of a soft mesh material. It's all on the inside, so it's all on the inside of the body. One thing I would mention is that we've found through research that we wouldn't recommend this for people who have had radiation, however. The artificial urinary sphincter it goes around the urethra itself, and it's kind of designed to replicate what the sphincter does. So it's always closed, just passively closed around the urethra. And when you need to go pee, you press a little pump in the scrotum, and it opens up the urethra. And over 90 seconds, the cuff slowly closes down. So during that time, you can go pee. And other than that, it's just kind of gently putting pressure to help close that urethra off. It's a great option for all types and all levels of stress incontinence. And as I mentioned, it's made of that pump in the scrotum, the cuff around the urethra, and there's a reservoir in the body that's the pressure regulating balloon that helps with that control mechanism to open and close it. So the male sling, one of the benefits is it's a minimally invasive surgery. You can start resuming normal activities, usually a couple weeks after the surgery. It's just in there supporting, so there's no interaction with the device, and it just works on its own, putting some pressure there. One of the nice things is you don't have to push any buttons, you have to do anything, so it lets you have some more normalcy and renew confidence. The artificial urinary sphincter, as we mentioned, mimics that sphincter, and what it does is, this is the part that goes around the urethra here, this is the pump that's in the scrotum, and that's the reservoir. Those are the three pieces that we talked about. Everything is on the inside of the body, so no one can see this, and only you know that you have it. And most men who have this get incredibly facile with it. It's a very quick thing because you're doing it multiple times a day. They press it, they pee in the toilet just like normal, and no one would be the wiser that they have it. So this is a little animation to show you for the artificial urinary sphincter. So that's going to be your pump there, which allows you to go pee, as we said, and then slowly closes over time as the fluid moves back into the balloon around the urethra, or I'm sorry, into the cuff. So if you, please feel free to ask any more questions. We're gonna field questions. I don't know if we wanna do incontinence now or field at the end, but we're here to help. This is what we specialize in. It's one of it's actually kind of one of my most favorite surgeries that I do because it's such an improvement in men's quality of life, and it can make such a difference, So we're here to help. This is what we do all the time, and I'm more than happy to talk to anyone if you're interested. Some of the risks that are involved with the surgery, the male sling, it can not quite make you dry. One of the things I do mention about it is that afterwards there is a risk of not being able to pee because the sling is too tight or from some swelling. That usually gets better with time, but we can also loosen the sling if we need to through another surgery. Some men do have to push to pee a little bit more because there's that extra pressure there. Obviously there'll be some pain. It's a surgery, so there's always a little bit of post-op pain afterwards, and the body just having a little foreign body response to the male sling. For the artificial sphincter, it's a device, so it can malfunction or fail, which may require revision surgery. There's about a 1 to 3% risk of the device eroding into the urethra because it is putting pressure around there, or infection. Again, there can be urinary retention, but with the swelling, but that usually gets better with a little bit of time, and some pain and soreness afterwards. The devices themselves usually last about 7 years, and we can go back and replace them for you. Insurance coverage can't be guaranteed, but most companies do cover this. Individual coverage may vary, and we pre-screen for this with you before we do the surgery, of course. So stress incontinence is a known side effect of prostate cancer treatment and other conditions. There are a variety of treatment options, and this is a quality of life thing, and we're happy to work with you to figure out what the best option is for you. As you may know, coping options can be expensive over time and can be uncomfortable. So we have some really good surgical options such as the sling or artificial urinary sphincter, which can offer a permanent solution for the stress incontinence. Thank you very much.
Thank you, Dr. Faris, for this phenomenal talk. And really, I'm sure there's a lot of questions, but I guess we're going to save it to the end, correct? Yeah.
Yeah, we'll hit both the incontinence and the ED questions at the end of the total presentation.
Wonderful. Great. Well, really very nice meeting you all. Let me share my slide. So I'll be talking to you about, let me see here, how can I make this slide mode?
If you go to the bottom right, there's usually a little slideshow icon, or you can probably go up to the top and go to view or slideshow.
Yeah, I got it here.
There you go.
Perfect.
Perfect, thank you.
Yeah, first of all, I really would like to thank Boston for sponsoring and you know, and making this happen, making this men's health webinar really a real thing, and we've been doing this for a while now. So thank you for the efforts to put in here. Tonight you have two specialists. Dr. Faris obviously talked to you about the urinary incontinence, and then you have me now on the erectile dysfunction. So normally we do one specialist, but now we have two. So it's great to have you know, the expertise of things like, Dr. Faris was mentioning, and I'm sure you have a lot of questions about that. So with that, I'd like to talk to you about erectile dysfunction and what's available, what's new about it, and really starting off with the definition of erectile dysfunction, or ED, defined as a persistent inability to achieve or maintain an erection firm enough to have intercourse. Really, it's quite common. It's the estimated to be about 1 in 5 American men over the age of 20 will experience some degree of erectile dysfunction in their lifetime. Obviously, the older we get, men, the more likelihood to get ED, and currently estimated to be about close to 40 million American men will have ED in their lifetime. So you see, there's quite common, and we've discussed that in detail about what the causes. Generally speaking, erections occur when men get aroused. The nerves that surround the penis became activated and fired up. The muscles around the arteries then relaxes, and more blood flow will go into the penis. Additionally, the blood makes the penis more stiffer, harder, and erected. This erection physiology eventually tighten the veins of the penis, so the blood will not leave the corporal chambers of the penis, and hence the penis remains erected. So you see from this diagram here, the two states, the flaccid state here, which is the state where the penis is soft, and you have the penis erected here. You see the blood vessels here, all these red dots here, all engorged and congested and full of blood, supplying this chamber here called the corporal tissue, or the spongy tissue of the penis, allowing the penis to enlarge, expand in size. Obviously, the urethra is down here in its own compartment. So the penis is really having this full erection on all dimensions, if you will. And that's what the normal erections occur. I love this kind of diagram because it really summarizes what the impact here. I mean, we talk about ED all the time, or erectile dysfunction, but what does it mean to a man to have ED? I think this kind of diagram summarizes the spectrum of the effect here, negative effect on men's health in general. You can classify it from a mental to physical to even psychological and beyond effect on men in general. So the quality of life in general become reduced in men with ED. That will decreases their social interaction with their partners, limit their ability to perform. There is also physical functioning issues, mental kind of disadvantage, if you will, and that will obviously has altogether have negative impact on the quality of not only erections but also overall relationship with a partner and so forth. Common question in the clinic comes to me, a patient asks me all the time, so why do I have ED, right? And this is kind of the chart I also love because it kind of summarizes what are the causes of ED. We talk about ED, you can see from this pie chart, 40% due to vascular problems. Huge chunk is due to, let's say, the blood is not reaching down to the penis, right? Causing this vascular insult, if you will. And within that, there is a lot of vasculature endothelial dysfunction that happen with the lining of the blood vessels. Diabetes as the main metabolic syndrome we have in the United States. Obesity is another one, lipid issues as well. All goes into the same kind of spectrum, if you will, and diabetes on the top of the list. It causes ED in about 30%. Huge chunk as well goes to diabetes. Medication side effects, I think historically, medication like beta blockers, the propranolol and atenolol medication can cause ED, but nowadays these medications are historical now, and I think that we have a new classes of medications that better control your blood pressure, and I'm sure some men are on it. So there are other medication can cause ED as well. I think the main thing is when your doctor give you a medication list or giving you a new prescription for medication, I think it's worth talking about ED as well. Does this medication cause ED? That's a worth discussion before you taking the medication. Other risks as well is, for example, prostate cancer surgery or radiation. Any pelvic surgery or trauma can cause ED because of the damage that happens in the muscles, nerves, the blood supply to the penis. And I'll show you some nice pictures as to why pelvic surgery in general can cause ED. And heart condition also goes along with the diabetes to some degree. If you have heart disease, that can cause ED as well. Specifically when you look at ED and diabetes, I mean, this nice chart kind of summarizes the prevalence of diabetes in general in the United States. We know about in 2020 and 2012 year, the census data from the United States show about almost 16 million men in the United States have diabetes, and among those men, about a good chunk of them, about 30% of these men will have ED. 1 in 2 men with diabetes will have some degree of sexual erectile dysfunction. And they tend to have, diabetic men tend to have worse type of ED. We call it severe ED. And that's because of the damage of the endothelial lining, the damage to the nerves, the muscles, because of the diabetes. And this is important, discussion, again, with your endocrine doctor or your PCP to discuss a good control on diabetes, and good treatment for diabetes, measured by a good control for the A1C levels and so forth, or with medication or diet or both, or insulin, to ensure that you have really good blood levels, good glucose or normal glucose levels, so that your ED will not be as severe as men without good control. So again, if you have diabetes, you could be at risk of having ED, and worth discussing that with your doctor as well. This is really nice diagram showing the wood diagram, what we call the arterial size hypothesis, which really correlates the size of the penile artery with other blood vessels in the human body, right, in the male body. So that's important because because we know the artery supplies the penis tissue, the corporeal tissue, with blood. And they're small. They're actually smaller than the artery supplies the heart, for example. So blockages that could happen in the arteries can actually reduce the blood flow, right? Which likely to occur in arteries that's smaller than the arteries that are bigger. That's why the ED could be a sign, an early sign of having underlying cardiac or heart issues, meaning that if you have ED, could be a warning sign or a check engine sign for men to get checked for their heart as well. Why? Because the artery supplies the penile tissue is smaller in size, so the blockage could happen easily in the penile artery before happening to the bigger arteries in for example, the heart. So again, this is a really good kind of wake-up call for the men out there with ED, and they think they may have kind of ED, to go and check their heart as well with their doctors. And it's a routine practice in our program here. Me and Dr. Faris and other providers here at the University of Chicago, we usually link when we see ED and the man is young or middle aged, let's say. We connect him directly with our cardiologist, and that's we have a full center for that. The men's wellness clinic we have at River East in downtown Chicago, where we actually have established some connections with cardiologists, for example, or diabetes doctors, the endocrine doctors, to be able to investigate and uncover those kind of big problems, if you will, using the ED as a as an early sign for heart disease, for underlying heart disease. I mentioned briefly about I think Dr. Faris nicely kind of laid out the incontinence issue with men having pelvic surgery, namely the prostate surgery. So likewise, I mean, ED could also develop after prostate surgery, right? And the reason why, because if you look at the diagram here, you have the bladder here on the top, you have the prostate in the middle, and then you have urethra, sphincter, and the urethra actually on this side here. So if the surgeon decide to remove the prostate for example, cancer, you can see the innervation that runs really close to the prostate gland, if you will, or prostate organ, which can exert or put the nerves and blood vessels under pressure, under a close area that can be affected by heat or surgery itself. Again, a prostate surgery can actually lead to ED in a good percentage. It's important to, if you decide on surgery for prostate or bladder surgery, you need to really have a discussion with your oncologist about what are the risks and how to overcome these risks and be more prepared for what's coming up. Again, I think the overall erectile dysfunction in men affect up to 75% in men who go for a prostate treatment. And that's true for men going for removal of this prostate by surgery, radical prostatectomy, which can last up to 1 year after surgery, or even for men who has radiation, men who doesn't want to have surgery, men who just want to have radiotherapy treatment for their cancer. Again, the risk is high, up to 50%. So again, it's worth discussing with the oncologist about what are the risks of ED, as well as incontinence for that matter, after treatment. Also, pulmonary disease is a common condition, could also develop after surgery or even radiation. Estimated to be in the range between 15 to 20% risk of having penile curvature, i.e. pulmonary disease after surgery or radiation for prostate cancer, for example, or any pelvic surgery. Again, because of the scar that build up on the layering, on the tunical layer, which is this layer here that's encircle the penis from inside and underneath the skin. This bulky, dense, fibrous plaque tissue that kind of build up on the penis and actually, unfortunately, deform the penis. It bends it. As you can see from this picture, the penis is bending upward. We call this a dorsal curvature that can make the penis defective and not functioning for the most part. It has another implication on quality of life. We mentioned ED is one of them. This is another one. Pulmonary can really affect them, the quality of life, the mental, the psychological impact is huge on men. And it also can cause ED. Men often report to us that cannot get an erection when they have curvature. Why? Because of the deformity that happens within the corporal tissue and narrowing and constrictions and deformity in the anatomy of the penile corpora. Anxiety and stress is important also in affecting the relationship with their wives and partners. The good news really, I mean, as everything in medicine, I think, the key is to have a good evaluation first, and then talking about options. And like everything in medicine, we have solutions here, and ranges from, pills to injections, to other devices like penile implants, vacuum reduction devices, and all other things we can offer. The key really for men out there is really to be able to engage into the conversation with their providers, urologist, or even their primary doctor, about these options, and get to see a specialist like us in our clinics to be able to discuss these items and discuss them and dissect them and see which one fits you the best. I mean, we can start with the oral medication. Oral medication, I'm not going to read the slide, but you can see the information out there. But really, pills available. This is very commonly available nowadays in the United States. It's been in the market for the last multiple decades. It works by, and the name for this Viagra, Cialis, Levitra, these are all we call the PDE5 inhibitors family. They work by increasing blood flow to the penile tissue and improve the ability to get erection and maintain it. It really works within an hour after the ingestion of the medication, and lasts for about 4 hours. It's taken on demand. There are other different modalities of giving, for example, Cialis on a daily basis or every other day basis for more intensified courses. But the idea here is to take it before sex on demand and improve the blood flow. It occur or it become effective in about 85% cases, it's obviously for men with risk factors for ED, for example, they have surgery or they have severe form of diabetes. The medication may not work as effective as other men. Important to discuss the side effects with the doctors as well. Side effects ranges between headache, facial flushing, stuffy noses, upset stomachs, and others. And important to make sure you're not taking any nitrates, for example, for the heart, because if you're taking nitrates like nitroglycerins and the likes of that, it can drop your blood pressure significantly and can cause significant issue with your heart. So make sure you're not taking those medications with the nitrates, and to discuss with your doctor about the side effects as well. The vacuum erection devices are hollow plastic tubes that place over the penis, and it can be either battery or hand operated devices is used to create a vacuum pressure that pulls the blood into the penis to get you full erection. Once the erection is achieved, a plastic tension ring is placed at the base of the penis to help maintain erection. It's effective in about 68 to 80% of cases, but despite the initial success, we know that the men may not like it because of the side effects, and namely is really it can block ejaculation, for example. It can cause bruising in the penis, discomfort and numbness and coldness because it's a plastic device. It can be cold as well, and as I mentioned, most men will change their treatment to other modalities based on this side effect profile that we discussed. Another common medication that given for men with ED is intraurethral medications. These are in the likes of Muse, which is almost like a gel, liquid medication. Gel medication can get injected into the urethral opening itself through a small little applicator, and then this medication gets absorbed into the circulation and getting the blood kind of expanding and flowing. We know the success rate can range between 40 to 65%, and about 50% of men don't continue on this medication after about 8 months because of the side effects. Again, namely the pain at the penis, at the urethra, or even in the scrotum area as well. Urethral pain and burning is common, and also can cause some systemic side effect like low blood pressure or even dizziness. A medication that I often give my patients is injectable medication into the corporal tissue. This is called ICI, or intracavernous injection of the medication, or Caverject, the name for it. There are different formulation. There's bimix, trimix, quadmix, from a specific compounding pharmacies around Chicago or even other states. It get injected directly into the corporal tissue and allow about 20 minutes to work, and about 60% of men will have some satisfaction in their erections. We know that there's about dropout, 20% will discontinue. In one study, about only 20% continued the therapy. So you see the majority of men did not continue on the study, continue on this medication in this study because of the side effects. And again, namely penile pain, fibrosis and scar, especially for men with Peyronie disease. I don't recommend that for them because it will make the scar even worse because of the buildup of the scar from the injections in the corpora. Priapism or prolonged erection, that's an emergency that require often surgery to cure. Sometimes even blood can actually accumulate underneath the skin side injections. That can be a problem as well. And most common reason for discontinuation is not having good erection, pain, and obviously nobody likes to inject the penis with any sort of anything. So that's a very legitimate and a reasonable reason for stopping these medications. I do, however, offer this medication also in my office under my supervision when I do my penile duplex scans. This is a very advanced testing imaging modality for the penile tissue circulation to evaluate for the circulation itself, if there's any blockages or leakages in the penile tissue. So again, in my practice, I do it in my office because I'd like to see the dynamic circulation within the penis. And so I would give it to my patients under my supervision. And lastly, I want to touch on the penile implant, which really we have a nice video to show you as well. But this is the kind of the option, surgical option for men who really has what we call medically refractory erectile dysfunction, meaning we tried the medicine and did not work, and men still having severe form of ED. The way it works is that there's a pair of cylinders that are implanted in the penis, and also a pump that's placed inside the scrotum, and a reservoir that has a third, reservoir that has a saline content, and this reservoir placed underneath the pelvic bone inside the abdomen. By squeezing and releasing the pump in the scrotum, the fluid can move between cylinders and creating an erection. Deflation of the device by pressing the button on the pump, allowing the fluid to travel back into the reservoir, and the penis becomes soft and flaccid and natural looking state. We know from data about close to 98% of patients reported satisfaction with excellent and satisfactory erections. And at 7-year period, about 94% of men still use and free of revision surgery. The most common side effects of these procedures are pain, which can be controlled with pain medications. Some mechanical issues could happen that require sometimes revision surgery, or even infections. Although the newer models, the newer devices from Boston Scientific is coated already with antibiotics, and it often has a very low risk of infection. I'd like to show you some information about the device and how it works. So this model obviously has a 3-piece model. The patient will reach down between the testicles and squeeze a pump, allowing the fluid to travel between the reservoir to the cylinders, getting a full erection. After the erections are done or sex is done, you press on a release button at the device and allowing the fluid to travel back into the reservoir, allowing the cylinders to deflate and giving you the flaccid, natural appearing penis. So you see it's very dynamic, very robust in terms of functionality and mechanics of this device. And it's all done through a small little opening through the skin of the penis to allow us to place this 3 component of the device. Healing is rather quick, and within 3-4 weeks, able to come back to normal function and able to use it and so forth. So really the benefit of the device is really to become designed to become a permanent solution for ED. It's spontaneous, have sex when the mood strikes. Obviously, you're not going to wait for the medication to work. Erection can last as long as you desire. The entirety of the device is within the body, so nobody will see it. Your partner will feel some part of it, but the sensation, the feeling, the ejaculation, the skin color will be the same. and has really high patient and partner satisfaction, as I showed you from data, and typically does not interfere with ejaculation, as I mentioned, or even orgasm. And it has been in use for over 40 years, and nearly almost 500,000 patients have been treated currently with penile implant. Like Dr. Faris mentioned, we have a team that can provide you with information about the insurance coverage for these devices, and often they really do a great job. Tell us about the patient coverage and tell you about the coverage as well, so you don't have to worry about these items. I mentioned briefly about the device itself and what it means to go for this, and happy to answer any questions at the end. But in summary, ED is a common problem and maybe associated with other conditions, as I mentioned, diabetes, heart conditions, pelvic surgery, trauma, and other problems. There's a variety of options from medical to surgical procedures. And penile implants could offer really a more permanent solution for ED in men. And please reach out to us if you have any questions. Obviously, there is lots of website information on the internet. edcure.org is one of the robust one that I've been using with my patients. With that, I'd like to thank you again, and happy to answer any questions.